Navigating women through breast and cervical cancer screening and diagnosis. After reviewing this PowerPoint, you should be able to explain why breast and cervical cancer screening is important, explain the role of the patient navigator in providing breast and cervical cancer screening services, name 3 barriers to healthcare often faced by the population you serve, explain the 6 evidence-based interventions a patient navigator might use to increase breast and cervical cancer screening rates, and list the 6 required patient navigator activities. Congratulations, patient navigators, on becoming part of the Juniper Healthcare team. Your role as a patient navigator is very important. You will ensure that women in the population you serve receive breast and cervical cancer screenings, follow-up, and begin cancer treatment if needed. While different organizations suggest differing breast cancer screening guidelines, Juniper follows those recommended by the United States Preventive Services Task Force. Here are the recommended breast cancer screening guidelines for average-risk women. And here are the recommended cervical cancer screening guidelines for average-risk women. Why does cancer screening matter? Breast and cervical cancers are an ever-present threat to the health of Kentucky's women. Early detection and treatment of these cancers through screening reduces mortality rates and increases the cancer patient's chance of survival. To get an idea of the impact of breast and cervical cancers on our state, let's take a look at the data. Always keep in mind that numbers represent real people: grandmothers, mothers, daughters, sisters, aunts. This graph shows the incidence of invasive breast cancer in Kentucky. Breast cancer is the most commonly diagnosed cancer among American women and is the second leading cause of cancer deaths among women in Kentucky. Kentucky's breast cancer incidence rate has gradually risen since 2010. As more baby boomers enter the 50 to 74-year-old age group, we are likely to see breast cancer incidence continue to rise. Increased breast cancer screening will also make the incidence rate rise. More screening means more cancers will be discovered. By looking at the age-adjusted breast cancer mortality rates in Kentucky, you can see the death rate has declined slightly. Hopefully, the decline will continue. Our goal is to increase breast cancer screening rates so that more breast cancers are detected early, when both treatment options and the chance for a cure are greatest. The incidence of cervical cancers in our state has risen slightly. Since HPV, or the human papillomavirus, causes most cervical cancers, increasing HPV vaccination rates should bring a decline in cervical cancer incidence rates. Cervical cancers are most frequently found among women who never or rarely had a cervical cancer screening. While cervical cancer mortality rates in our state are not astounding, we must remember this cancer, for the most part, is a preventable disease. Not only is the HPV vaccine effective in preventing cervical cancer, Regular screening can allow abnormal cervical cells to be found and removed before cancer develops. Even one death from cervical cancer is too many. You may be wondering how you can make a difference in breast and cervical cancer screening rates. With direction from CDC and the collaborative efforts of your team, you will apply evidence-based interventions, or EBIs, as part of your strategy to increase screening rates. Evidence-based interventions are strategies or activities that have peer-reviewed, documented, empirical evidence of effectiveness. Some interventions that a patient navigator might implement are these. Client reminders. These can be letters, postcards, telephone, email, or text messages that remind clients when they are due for a screening. Reminders can be enhanced by providing a follow-up reminder, phone call or print, by giving additional information such as the benefits of screening and ways to overcome barriers, or by offering to schedule the appointment. Reminders can be targeted to the general population or can be individualized for a single person or a specific subset of the population, for example, specific ethnic groups or age groups. Small media. This can be printed material such as newsletters or brochures, or it can be video. Small media can be used to inform and to motivate clients to be screened for cancer. Group education. This intervention can be delivered to a variety of different groups in many different settings. Patient navigators can share information on indications for and benefits of cancer screening and may offer ways to overcome barriers. One-on-one education. Like group education, this intervention is a way to inform, encourage, and motivate clients to seek recommended screening. One-on-one education is often supported by client reminders and small media, such as brochures. Reducing structural barriers. Some women have difficulty accessing care because of the lack of availability of services. The services may be too far away, or the hours of availability may be very limited. These women may need assistance with scheduling appointments or with finding providers that offer services during extended hours. Reducing out-of-pocket costs. Economic barriers, such as lack of insurance or high copays and/or deductibles, prevent some women from obtaining care. Patient navigators will look for ways to remove or reduce those barriers, such as helping the client access community services. Many of the women in the population you serve will have to overcome significant barriers in order to complete cancer screening and follow-up. There is a disproportionately low rate of screening among women of racial and ethnic minorities and among those who are economically underprivileged. These populations often face barriers to care that prevent them from accessing the same level and quality of health care as the general population. That's where the patient navigator can help, by finding ways to remove or minimize those barriers. But what are barriers? A barrier is anything that prevents someone from receiving adequate health care. For some, their financial limitations might be a barrier. Perhaps they are uninsured or underinsured. Maybe just being able to afford gas for the trip to an appointment presents a problem. For someone else, the barrier might be language. Providing a translator might remove her barrier. In 2018, Juniper identified the following as the most frequent barriers encountered by their patients: no insurance, a low level of health literacy, and cultural differences. While noting that the population served at Juniper as a whole faces these barriers, Remember that the individuals within this population will have their own unique situations that might present different barriers. For instance, one patient navigator in Kentucky shared this story. One of her clients was a male cancer patient in rural Kentucky who was refusing cancer treatment. She learned the reason for his refusal was that he didn't have anyone to care for his pet while he was in the hospital. The patient navigator found a volunteer to take care of his pet during the times he would have to be away from home for treatment. The barrier was removed, and the man agreed to treatment. This slide provides just a few of the ways a patient navigator might help a patient overcome barriers. There are many others, such as educating the patient on why cancer screening is important, addressing financial needs, and on and on. Your list of ways to overcome barriers will be as long as the list of different barriers you will be challenged to resolve. As a patient navigator, you will see that good communication with the patient is key to a successful outcome. Sometimes the patient will be quite open with you from the beginning. Other times, you will have to take time to build that trusting relationship. You will find that the number of patient contacts needed to reach the desired outcome will vary. 2 contacts will be required, but usually more will be needed. Often the patient's family, a friend, or a significant other is involved in the situation and can be either a source of great support or an opposing force. Your relationship with them will be important too. Sometimes the biggest obstacle to care is the patient's lack of motivation. Motivational interviewing skills can be a useful communication tool. As an introduction, please take advantage of the motivational interviewing resources listed at the end of this PowerPoint. As you may know, Juniper's Patient Navigator position is funded in part through the Kentucky Women's Cancer Screening Program, or KWCSP, with funds from the Center for Disease Control and Prevention's National Breast and Cervical Cancer Early Detection Program. Whew, that's a mouthful. The funding is attached to requirements that include the following patient navigator activities: assessment of individual patient barriers to cancer screening, diagnostic services, and initiation of cancer treatment. Patient education and support. Resolution of patient barriers, for example, their transportation issues or a need for translation services. Patient tracking and follow-up to monitor patient progress in completing screening, diagnostic testing, and initiating cancer treatment. For example, follow-up phone calls to ensure patients' appointments are kept. A minimum of 2, but preferably more, contacts with the patient. While at least one contact should be face-to-face, not all contacts need to be. Collection of data to evaluate the primary outcomes of patient navigation, cancer screening and/or diagnostic testing, final diagnosis, and initiation of treatment. Please be aware that we anticipate a separate patient navigation data collection training to be provided to you by the end of this year, 2018. The patient navigator will ensure timeliness of follow-up. When the patient navigator guides a woman to her cancer screening appointment, his or her work with this client has only just begun. The patient navigator must follow up to ensure that results are received so the client can be notified in a timely manner. Any woman with an abnormal screening must receive appropriate and timely diagnostic procedures to arrive at a timely final diagnosis. Any woman with a diagnosis of breast or cervical precancer or cancer must be referred for appropriate treatment, and that treatment should be initiated in a timely manner. The patient navigator will navigate the client through appropriate steps of the process, making sure that each woman moves through the cycle of care in a timely manner. But what qualifies as timely? Here are suggested guidelines for timeliness of care. Patients should be notified of screening or diagnostic test results within 10 working days of results being received at the clinic, but no later than 30 days from the date of the screening test. Even though the patient navigator may not be the one to notify the client of results, he or she must monitor for timeliness of results being received and client being notified. The interval between abnormal breast cancer screening results and final diagnosis should be no more than 60 days. The interval between abnormal cervical cancer screening results and final diagnosis should be no more than 90 days. The interval between final diagnosis and initiation of treatment should be no more than 60 days. Often it can be celebrated when patient navigator services end because it will mean there is no longer a health issue to navigate. Patient navigation services will end when one of the following occurs. The woman completes screening and has a normal result, or the woman completes diagnostic testing and has normal results, or the woman either initiates or refuses cancer treatment. Patient navigator services do make a difference. Patient navigation has been found to increase screening rates, decrease time between abnormal screening and diagnosis, increase rate of timely initiation of treatment, and improve quality of life and increase satisfaction with the healthcare system and cancer care. Let's take a look at a real-life example of the difference made by patient navigation. In 2010, the New York State Cancer Services Program initiated a project to identify women in need of breast or cervical cancer screening services that did not seek preventive care, and then reach out to those women with patient navigation services. Two trained patient navigators from the area and familiar with the resources available assisted women by addressing barriers, discussing the importance of breast and cervical cancer screenings, identifying resources to overcome barriers, communicating with provider offices to ensure that patients attended appointments, and assisting patients in accessing diagnostic and follow-up treatment services. The results? Aggregate data from across the 12 involved federally qualified health centers showed a baseline screening rate of 19% for breast and 6% for cervical cancer at the beginning of the 18-month project. The screening rates at the end of the project increased to 52% for breast and 37% for cervical cancer screening. What a big difference patient navigation made. We are confident that patient navigation services will make a big difference at Juniper as well. Remember, you, the patient navigator, are a very important part of the healthcare team. Patient navigators motivate, guide, and assist women in overcoming their individual barriers to care. They tackle issues of health disparity head-on, elevating their clients to an equal playing field, and they promote access to quality care for all. Please take note of the patient navigator training resources listed here. And please feel free to contact the staff at the Kentucky Women's Cancer Screening Program with any questions or concerns you may have. We are here to support you. Thank you.